Hi, I'm Rob, a researcher from MIT, and I'm going to talk to you about our work on mental health treatment personalization using recommender systems. To set the context for our work, engagement with mental health apps is a huge challenge. Here, you can see the day-end retention rates with publicly available mental health apps. And what we see is that after 15 days, less than 4% of people are still using them. This is a real shame and a real challenge, because if we could make these therapies more engaging, more users would get the mental health support that they downloaded these apps for in the first place. Importantly for our work, a key factor that explains why these engagement rates are so low is the lack of personalization in these apps and in their embedded therapy protocols. That's why we assess recommender systems, as they may allow us to personalize mental health therapies. These algorithms have been very successful in increasing engagement in other domains such as news, movies, and music, and we believe that by carefully modifying them, they could also be useful in mental health treatments. We focus on collaborative filtering algorithms, given they often achieve the best accuracies in other domains. And specifically, we test how accurately they can predict the ratings of tasks that users have not tried before. We use data from a publicly available and free therapy game. The game implements behavioural activation, which is an evidence-based psychotherapy, and there are 75 therapy tasks in this version of the protocol from 5 different categories. Over 4,000 users rated tasks in this app, with over 30,000 ratings in total. And the ratings are on a scale from 1 to 5 based on how much they improve a user's mood. To evaluate if recommender systems can be useful, we compare how accurately they can predict new task ratings versus well-recognized recommender system baselines. We find that the best collaborative filtering algorithm, which in our experiment is a neighborhood-based model with adjustments for the user item bias, improves considerably over these baselines, with a more than 8% improvement over the stronger one. And furthermore, when we incorporate contextual variables, such as the time of day of week, and attributes about the different therapy tasks, we find that they are slightly more accurate still. So while there is still some way to go in making these algorithms even more accurate, we conclude at this stage that collaborative filtering algorithms should be considered as a promising solution for therapy personalization in mental health treatments.